Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, September 21st. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good afternoon. I want to start by acknowledging that it is Toronto Public Service Week. It is a week we set aside each year inside the city government where we celebrate all those who work for the city providing important services to our residents. And as I began the morning at the Kipling Water Yard and thank them in person, I want to publicly thank through the means of this briefing all city employees for the work they do in providing residents with excellent frontline services. You know, if you look at this year, it's been an unusual year. I think that we're blessed with a public service that provides excellent services to us all the time. But this year in particular, there have been special challenges placed in front of our public servants who have nonetheless ensured that vital public services that residents and business depend upon have been delivered to people and delivered in many respects without missing hardly a beat. And so I say thank you to them for their hard work in that regard on behalf of myself as Mayor and the members of City Council, but also on behalf of the people of Toronto who I think, when they think about it, understand that most of their city services, most of the time, the vast majority of the time, have been delivered to them, notwithstanding big challenges put in the way of the public servants who deliver those services. Now, Dr. Davila will be providing an update on the fight against the COVID-19 virus today and reiterating her public health advice for city residents. I have asked, and it didn't take much invitation, I've asked, because she does this every day, for her to speak as clearly as possible about the real risk at hand right now and how people can protect themselves and their families with their own actions right now. Because it's science and there are still many unknowns, and because it gets complicated with work and family and friends and indoors and outdoors and all the rest, the need for as much simplicity as possible now is very important. The bottom line, regardless of limits and circles and bubbles, if you don't have to do something in person or in groups, then don't. There are many other ways to do things. We've discovered that during the course of this pandemic. So if you don't have to do something in person, whether it's in a big group or a smaller group, don't. I hope this will be a wake-up call for everyone, including these most recent guidelines and rules put in place by the Premier over the course of the weekend, and I commend him for taking that step. But it's a reminder, all of these things are a reminder that the virus is still here, still spreading in our community. As the numbers show, we have to tighten up our own behavior that may have loosened up over the summer as the case counts went down, as we did quite rightly go about a gradual reopening, including back to school, knowing that an indefinite lockdown was impractical and not sustainable. But we simply have to change the way we live now and do this in order to prevent that kind of spread, that kind of future lockdown from happening. I know anecdotally that people have started adjusting their behavior in response to the new gathering limits already. I know of a wedding held on Saturday, for example, where 2 hours ahead of the ceremony, in light of the changed rules, non-family guests were uninvited and they ended up sharing the occasion via Zoom due to the new rules. What a good example of placing health and good citizenship first. Thank you again to that couple and to many others like them who are doing the right thing and making changes at great sacrifice sometimes to their own plans and to their own lives in order to stop the spread of this virus and protect their own health and the health of other people, including family and friends. We've worked hard to reopen our economy safely so that we can get more people back to work and help businesses stay open and help resume a certain sense of normalcy to life in the City of Toronto and beyond. If we all follow the public health advice now, wear a mask, wash our hands, keep our distance from people, we will ensure that we don't need a further lockdown and that we can keep moving forward. I know the vast majority of Toronto residents will hear this message and make sure they're doing the right thing. Most of them are already doing the right thing. In our meeting of the mayors of the GTA's 11 biggest municipalities today, they asked that we draw attention collectively to the need for compliance in restaurants. Things like table maximums. There are rules on this. Restaurant capacity maximums, just to name two. They also pointed to the need for total compliance in banquet halls where large events are still permitted. And on a final note from those mayors, including myself, We want to remind people that if you absolutely have to have some kind of a gathering, dinner party or whatever for 8 or 10 people within the rules in your home, mask wearing and physical distancing, even in a private home, will help to contain the spread of this virus and keep people safe. I also know that Chief Pegg will be outlining today our enhanced enforcement strategy for this fall, which includes Toronto Police, municipal licensing and standards, and Toronto Public Health, to make sure that those who aren't doing the right thing get the message. I spoke to him this morning, and I know that he agrees with my own personal belief that it is time to get much tougher, to bring the hammer down, as it were, when it comes to enforcement. There is a time, as there has been, for education. There is a time, as there has been, for warnings. And then there is a time to enforce the law and to indicate clearly to those who won't comply that there are consequences. I believe most people acknowledge we have arrived at that time. Simple public health advice, fairly simple rules. There is a lot at stake. It is time to comply. And on that note, I will ask Dr. Davila to provide her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. Since our last report, we have continued to see a steady and concerning increase in new COVID-19 infections in Toronto. Today, I'm reporting 453 new COVID-19 infections in our city since Friday. This brings our total COVID-19 case count to 17,712. A total of 15,409 people have recovered from the virus. I have only one other thing to talk about in my update today. As a doctor, I'm trained to tell people things they don't want to hear. I hate doing this, but as a doctor, it's my job, and it's part of my job to heal. This means helping people who are healthy stay that way, and making sure that people who aren't healthy know what they need to do to get better. I don't want there to be even one COVID-19 infection in Toronto that could have been prevented. So it's my job today, as your medical officer of health, to tell you what you need to hear. And it's this: life has changed, and all of us have to act like it. But I fear that on some level, too many of us are unwilling to make the changes we need to make to keep everyone safe and limit the spread of COVID-19. Of all the things that I worry about at 3 o'clock in the morning, that's what worries me most. I'm afraid it explains why too many people are doing things that are making the spread of COVID-19 worse. Let me be clear. There are many, many people who become infected with COVID-19 because of circumstances beyond their control. Their work, or their home, or their health place them at a greater risk. But that's not what I'm talking about. What I am talking about are the cases that could have been prevented, but weren't. The cases that happen because people let their guards down. Because people made, "I'll be fine," or "who could it hurt" decisions, without fully appreciating who it could hurt. We are all human. There is almost nothing that's harder for us than facing uncertainty. We cope by denying what we fear, by ignoring what's unpleasant, by telling ourselves, it won't happen to me. Or if it does, it won't be that bad. We justify choices that we know, deep down, probably aren't the best. We make mistakes. And at the same time, we know what safe behavior looks like. We've been in this for nearly 7 months. And the steps for self-protection are clear. Watch your distance. Wear a mask. Wash your hands. Don't gather in large groups. Be selective about where you go and when, and what you do to protect yourself when you're there. We are able to avoid putting ourselves and others in harm's way. But a lot of us aren't. So I had to ask myself, why? We knew infections would rise with reopening. But why is it happening to this extent? And I keep coming back to the idea that on some level, too many people refuse to accept that everything has changed. Things have changed. And we need to change too. We have a serious problem on our hands with COVID-19. We can outlast it by protecting ourselves, but we can't ignore it. So we have to choose to live differently, at least for now. COVID-19 is here until there's a vaccine, and we have to act differently until we get it. We have not passed a point of no return. I've said that before, and I will say it again. We can still turn this around. We can still do many of the things we used to, but we cannot do them the way we used to. Not for now. We have to accept that and make the best of it until we've got a vaccine. The best of it will be fewer infections and tougher choices by each and every one of us. When a doctor diagnoses a patient, you give them a sense of control by discussing what they can do. And this is what you're going to have to do between now and the day that COVID-19 is under control. You're going to have to be really disciplined. Please, be serious about keeping your distance from people that you don't live with. Keep wearing your mask as much as you can, especially when you're with people you don't live with. Keep washing your hands a lot. You're going to have to be really thoughtful. Weigh your options. Ask yourself, do I have to go, or do I just want to go? And if I decide to go, how can I make it safer or lower contact? You're going to have to be really kind to each other, because this is hard. This is not an easy way to live. And you're going to have to make some sacrifices to do all of this, to get us to the other side of this pandemic. We are going to get through this. It is going to end. I ask you all to think about that and what you will do as we move forward through the pandemic and toward the day when COVID-19 is under control. I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. Today marks the 195th day of continuous operation of the city's Emergency Operations Center in response to COVID-19. The enforcement of public health-related regulations has been a top priority for the City of Toronto since the outset of COVID-19. As always, we have done all that we can in order to achieve compliance through education as opposed to enforcement. We understand that the public have been asked to significantly adjust their behaviors in response to COVID-19. This is why we have given people the opportunity to understand what is being asked of them and to comply. I'm both proud and pleased of the vast majority of our residents and business owners who have done just that. Unfortunately, a few have not. Enforcing the law, regardless of the context, is a necessarily complicated and complex process. Enforcement requires investigation, the gathering of facts, and the application of often complicated legal process. Enforcement action demands the independence of authority on the part of the relevant enforcement agency and their respective enforcement officers. This has and will continue to be protected and maintained throughout the COVID-19 emergency. A complaint by the public that a law or bylaw is being contravened must be investigated and confirmed by an enforcement officer before a charge can be laid. Many complaints that are received do not result in the determination that the law is being contravened, and therefore do not result in enforcement action being taken. However, it is important to understand that the City of Toronto has taken formal enforcement action 1,408 times to date in response to COVID-19. This weekend, we received 21 complaints relating to gatherings. The investigations into these specific complaints determined that the thresholds for enforcement were not met. In a number of these cases, the reported gathering may have dispersed prior to the arrival of the enforcement officers. The amendments to the provincial regulations relating to gathering sizes are being implemented in direct response to COVID-19. Large gatherings are resulting in increased transmission and spread of the virus, which places both the health of our residents as well as the capacities of our healthcare systems at risk. In my role as COVID-19 Incident Commander, I have convened enhanced enforcement coordination meetings with our respective enforcement partners to ensure that we are fully connected and coordinated on all aspects of COVID-19 related enforcement. Our strategy is straightforward. We will enforce provincial regulations in an effort to arrest the spread of COVID-19. This is complicated work that involves a number of enforcement agencies, including Toronto Police, municipal law enforcement officers, and Toronto Public Health Enforcement officers. To that end, we are actively enforcing the regulations relating to COVID-19 in Toronto in support of our primary goals of saving lives, preventing the transmission of COVID-19, and preventing the healthcare system from becoming overwhelmed. We are in the process of again streamlining our intake and dispatching processes for these types of complaints in order to provide an increasingly focused and robust response across the city. I am directly connected with Police Chief Raymer on this and all other matters pertaining to public safety, and will remain so as the situation with COVID-19 continues to evolve. COVID-19 is still circulating in our city. This is a serious matter, and the public should be assured that we are treating it as such. As we all know, the Province of Ontario recently introduced amendments to the Reopening Ontario Act that impose additional restrictions on gatherings. Our coordinated enforcement teams are actively enforcing the amended gathering size restrictions. We are working together to achieve one overarching goal: preventing the continued spread of COVID-19 in Toronto. I want to be very clear. When people choose to behave in a manner that is contrary to the established public health regulations, they are placing their lives and the lives of their loved ones at risk. They are also potentially undermining the capacity of our healthcare system and prolonging this pandemic. It simply should not require enforcement action to prevent these behaviors from happening. However, where our enforcement officers determine that they have reasonable and probable grounds to believe an offense has occurred, we will not hesitate to take enforcement action as required. The proposed amendments to the Reopening Ontario Act will empower police officers to order that a premises be temporarily closed if that officer has reasonable grounds to believe that an organized public event or other gathering is occurring at the premises and that the number of people in attendance exceeds the number permitted. Further, the proposed amendments will stipulate that a person who hosts or organizes a public event or other gathering at residential premises or other prescribed premises, and the number of people in attendance exceeds the number permitted, is guilty of an offense. There are prescribed penalties associated with being convicted of an offense under these regulations. Most recently, $10,000 for an event organizer and $750 for an attendee. The coordination of enforcement action relating to all COVID-19 related orders and regulations is a standing item on our Strategic Command Team agenda, which I am responsible for leading, and this topic will continue to be a priority for our team as the pandemic continues to evolve. Together, we will continue to do all that we can to protect the health of our city. I implore everyone to comply with the gathering restrictions, to continue to keep your distance from others, wash your hands, and to wear face coverings when distance can't be maintained. In closing, I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief Pegg. Before we go to questions, to let reporters know that staff on the line include those from Shelter Support and Housing, Senior Services and Long-Term Care, Parks, Forestry and Recreation. As well, we have today Police Chief Jim Raymer on the line. First question is to Austin Delaney from CTV News. Austin, go ahead, please.
Thank you, Doctor, and also Mr. Mayor. Would you mind painting a picture of how this is spreading? Is it people going to these patios on the streets and going in different groups, different nights? Just paint a picture of who's doing it and how it's happening, please.
So why don't I start off with that? What we're seeing in our data is that we are getting infections and cases are actually represented in neighborhoods all around the city. I will say that as of late, looking at the last, say, 4 to 6 weeks of data, compared to the data that we have from earlier in the outbreak, we are seeing a greater preponderance of cases amongst the younger age group, notably those under 40 years of age. And in the last, say, 4 to 5 weeks or so, it's been, roughly 2/3 of our cases are in that younger age grouping, less than 40 years of age. And as of late, that 20 to 29-year-old demographic is also extremely well represented in our numbers right now. And what we can say when we look at the data and get the specifics from the cases as part of the case management process, certainly social gatherings with non-household members figures prominently. It's not necessarily the only thing, and for some of these cases, it's not patently clear exactly from whence the infection came. But it is of note, and it is important, that social gatherings with non-household members figures prominently when we ask our cases about what behaviors and activities they've engaged in over the period of time that is most of concern.
Can I just add to that? And again, I think we are benefiting from trying to keep this as simple as possible. But if you're going places you don't have to go, if you're doing things you don't really have to do in person with others, then this is probably increasing the risk overall to the community. And when we talk about things like, even if you, for some reason or other, have to have, 6 people over for dinner, so it's within the permissible limit, the whole notion of sitting at a table with people you know in your own home wearing a mask sounds weird. And it probably is weird relative to everything we're used to, but it's probably something that's going to help. If people wear the masks, and they wear the masks in restaurants, at all times, not just kind of coming in and coming out. So I just think it's one of those things where we really have to ask ourselves, as Dr. Davila has said, as I've said, as others have said, do I have to be doing this? Do I have to be going to this place? Do I have to be having these people over? And if the answer is not really, well then, don't, please.
By means of a follow-up, if you don't mind, for one of my colleagues, open houses, real estate open houses, can you confirm that there's some contact tracing going on because of a potential case there, and are there concerns about this?
So I can't speak to the specifics of that, but certainly every time there is a case that is identified as a positive case of COVID-19, there is a case management process and contact tracing that follows along with that. That's how we have been managing throughout this entire pandemic, and that's how we actually identify who's at risk and make sure that they're alerted to the risk exposure and what they can do, what measures they can specifically do to protect themselves. But to reiterate the point that the mayor just made, we know about virus transmission. We know about how this virus is transmitted from one person to the next. And we know that the best prevention is distance, distance, distance. So that's not just about keeping 2 meters of a perimeter around yourself. But in fact, when you think about watching your distance, it speaks also to minimizing contact with people with whom you do not have to have contact. So these are the fundamental bits of prevention, along with case and contact management, which is of course an important role for public health to play. But prevention is the best strategy, and avoiding those circumstances with in-person contact where it's not absolutely necessary is an excellent strategy to prevent transmission of COVID-19 and to protect our community.
Okay, thank you. We go next to Ashley Legasic from News Talk 1010. Go ahead, Ashley.
Hi there. Thanks for taking my question. I'll ask Mayor Tory and Chief Pegg to please weigh in on this. I want to touch on the enforcement that was just spoken about. Only 21 complaints made to the city over the weekend. With a population of 3 million, that seems pretty low. So is the approach still just responding to complaints? Or can we expect some enforcement blitzes, some proactive steps? If so, where would the priority areas or events be?
Well, can I just say at the outset, the approach has never been just to wait for complaints to come in. The complaints are helpful because they obviously allow you to direct yourself to a particular address or a particular occasion, but throughout the period of the pandemic, we have pointed out that there are many bylaw enforcement officers and police officers who are out across the city on patrol all the time looking for things that don't seem to be the way they should be. And so I'm sure all of that will continue. And the other thing that we've been told by the law enforcement people, and Chief Pegg may wish to address this, is that those rules that we're talking about that limit crowd size just came into effect on Friday. They've indicated to us, those familiar with how complaints work and how law enforcement works, that we should expect that number of complaints to rise quite significantly in the days ahead, and that then gives us a more targeted opportunity to go out and visit places people have specifically identified. But I think it's fair to say that the complaints that came on the weekend were the ones that came, and there will be more to come, and that there are eyes on the street all the time, whether it be police, bylaw enforcement officers, public health people, looking for instances where people are doing things that are going to be contrary to containing the spread of this virus. And so, they will carry on with that work.
Yeah, thanks. I can echo everything the mayor just said, and I'll just add, certainly the proactive enforcement activity is very much ongoing, and like Mayor Tory's indicated, has been from the start. We have, from the beginning of this pandemic, have prioritized the deployment of those resources to the areas of largest concern and the areas in which our public health professionals tell us represent the largest concerns. And that, as you know, has included things like parks and beaches and certain non-compliant business inspections. Proactive enforcement and proactive public safety is, I would say, the foundation of our system here in Toronto, and I fully anticipate that will continue. And as the Mayor said, we are very much expecting that the number of complaints will rise. That's one of the reasons why I quickly convened the enhanced coordination meetings between all of our enforcement partners, such that we remain ready and are potentially even increasingly ready to deal with those number of complaints. So we're in a good position and certainly ready to enforce as required.
Thank you. And my follow-up will be for both you, Mayor Tory and Dr. Davila. We got word today that the Christmas market is not going ahead this year. It's been canceled. So first of all, just a reaction to that. And obviously there would be activities there that wouldn't necessarily be pandemic friendly. So what about Halloween? Would trick-or-treating be a safer task? Should we be avoiding family get-togethers for Thanksgiving? What are your thoughts on those?
I came back from the weekend and raised at our meeting this morning Thanksgiving because people started to talk about it just in the groups of people that I met over the weekend. We've previously raised Halloween, and in fairness to everybody, there's been a great focus on getting the kids back to school in a safe manner and on dealing with the increased numbers. But we all recognize the fact that that Halloween and Thanksgiving in reverse order are on people's minds. They want to know the right thing to do. They want to know what they should not do. And you can expect that in the very few next days, we will have advice in that regard for people. I mean, it's very difficult to ban Thanksgiving and ban Halloween. I'm not sure anybody would try to ban them, but I think what you can do is give people the best advice possible on how to keep them safe. I discussed this matter with the Premier, and we discussed it among all the mayors of the biggest cities in the GTHA today, and we know that we have a collective assignment to stay on the same page, to give consistent advice, and so that's what we take the time to work out, is what is the best advice and to make sure it is shared consistently across the GTHA simply because you want to avoid public confusion. With respect to the Christmas market, it is one of a number of events at that time of the year that is unfortunately not going to be held. In this case, as with most of the cancellations this year, the decision has been taken by the organization itself, looking at the health situation and all of the other circumstances they would want to examine. It's regrettable, extremely regrettable, because these are things that bring people joy and get them outside even in the colder weather. But a lot of things have changed this year, and let's just hope that we can get through a roster of events we will deal with in the next few days that probably won't be held on a normal basis at all, and get back to something more normal next year if we follow along, not only by canceling these events, but by behaving in the way that we've talked about for the last few days.
So if I can just add a little piece to that, I think the Mayor covered that extremely well. There's not much more to add. I think the only thing I would say, as I mentioned in my remarks, we can still do many of the things we used to do, but we just can't do them in the way that we used to, at least not for now. So, please stay tuned. We recognize that there is some attention, certainly an interest in understanding what is the safest way? How can we manage some of the traditions that we're used to having? Thanksgiving, Halloween, and many other traditions that make life great in the city. How do we continue to preserve some form of those traditions while at the same time ensuring that we're safe and limiting the spread, or as safe as possible and limiting the spread of COVID-19? We'll have more for you in the coming days, but please know we are absolutely working on that. And it's a question of just finding what are the modifications that we can put into place so that we can honor these traditions and enjoy and have celebrations, but still at the same time ensure that we are limiting the risk and limiting the spread of COVID-19 in our community.
Okay, thanks. We go next to Mark McAllister from City News. Go ahead, Mark.
Thank you. I might be jumping ahead based on what Dr. Davila just said about the coming days. However, this morning's Board of Health meeting, you were given some support to take further action. I'm just wondering, beyond the enforcement we're talking about, what more will be done to expand mask requirements in the city at this point?
So, Mark, you're quite right. There were a number of conversations that occurred at this morning's Board of Health meeting, and it was very productive, and I'm very glad to have the support and the continued support of the Board of Health as we navigate this pandemic. Not prepared at this point in time to get very specific, but suffice it to say that we need to look at all the options that are on the table and understand what are potential avenues that we can pursue under which conditions. This is part and parcel of managing the pandemic, and it's part and parcel of good public health practice. Understanding what's happening in our community and adjusting our actions and adjusting our messaging in particular to the public in order to best address the circumstances that we see in front of us. That's why we're asking people to really think carefully about what they're doing. Think about how they might better contribute to controlling COVID-19 in our community, particularly for those events where it's not that you have to do it, but it's something that you just want to do. We can turn this situation around. There is a way in which we can actually live reasonably safely with COVID-19. We just don't want to see preventable infections. And I know that when we work together, individuals in our community, yes, combined with the efforts of public health, including, policy changes and enforcement and all the things you've been hearing about, these actions taken together are the kinds of things that we can put into place to help protect our city. But it still comes down to the individual actions. We need people to absolutely adopt those self-protection measures. We know they work. They've seen us through the first part of this pandemic. They will see us through the months and weeks ahead. So I would encourage people to really focus on those and commit to being more disciplined and more thoughtful and frankly more kind, because this is hard.
Follow-up, Mark?
Some of the options, some of the options that have come up as well and have repeatedly been asked about, and I'll ask the question again, publicly sharing more detailed information. Is it possible, and I know, again, you've got an endorsement from the board this morning to do just that. Will we see more detail in terms of what's being made available to the public in the near future? Workplace outbreaks, for example, similar to other places like shelters, schools, et cetera.
So as you know, Mark, that was a direction we received from the Board of Health, endorsement, as you said, to explore how that might be done in a manner that appropriately protects privacy. And at the end of the day, here is the fundamental goal of public health, absolutely to improve the health status of the population and to reduce any inequities in that health status. And insofar as the sharing of relevant information supports that, that is what we seek to do each and every day. So we want to put information in front of the public so that they can help themselves create those conditions that allow them to enjoy optimal health so that they can make good decisions for themselves and for those around them. So, in keeping with the board direction that we received this morning, the team at Toronto Public Health and we will be exploring that, and, I'll ask you to stay tuned for that. We just got direction this morning, haven't had a chance to really, get into the conversation yet about what this looks like on a go forward, but we'll look forward to discussing with you, the other members of the media and the broader public, what that looks like.
Okay, thanks. We go next to Matt Bingley from Global News. Go ahead, Matt.
Hi, good afternoon. Chief Pegg, you were talking about those 21 complaints and the fact that people were maybe appeared to have dispersed before enforcement could actually get there. Could you just elaborate a little bit more on that? Is this what, and perhaps Chief Raymer could actually weigh in on this as well, if it's something that the force and those enforcing the rules needs to maybe change tactics to change up, catching people in the act, or is it like a matter of people, running through backyards to get away from police before they get there? Can you just tell us a little more about that?
Sure, I'll start, Matt, and then defer to Chief Raymer. So as I explained in my remarks, the investigation or the enforcement of any law, rather, requires a comprehensive investigation on the part of the enforcement officer. So that means that in order to warrant moving forward with any type of enforcement action, reasonable and probable grounds need to be established in the opinion and in the experienced opinion of the investigator that an offence has been committed, and then of course at that point in time, once that threshold has been met, enforcement action would take place. As I understand it, this weekend there were a number of circumstances where complaints were received with respect to gatherings, and upon arrival of the inspecting or the investigating officer, that was not the case. So there is some suspicion that, I guess simple logic, that apparently there was some, by some means, the gathering dispersed prior to the arrival of the enforcement officer. But Brad, I'll defer to Chief Raymer, who I know is on the phone.
Go ahead, Chief.
I guess really the focus up to this point in time has been on education and cautioning. And we did have, I think, approximately 20 calls into our call center on the weekend. And on the vast majority, the situation, there was nobody there once the police arrived. On a couple of occasions, we did have communication with people there, and it was resolved by cautioning. Going forward, though, and working with our municipal licensing partners in public health, we're going to have a much more coordinated and consistent approach. And the issue of education and cautioning is going to be replaced by enforcement.
And Chief Raymer, if I could just follow up with that, if you look at Brampton compared to Toronto, they've been quite vigorous with the amount of people that they have charged. Could you explain what the difference is in how their approach may be versus Toronto? And just in relation to that change of education versus cautioning, enforcement in relation to cautioning, has it been your directive to the force to really lay the hammer down like the mayor is suggesting should be the case?
There's no direction to lay the hammer down, as you say, but we will be having a more focused, coordinated, and consistent response. We're looking at a specific group of officers to work with our licensing partners to address this issue in a consistent fashion. And as I've said, the focus now will be more on enforcement rather than just the focus on education and cautioning. That had been working, I would say, quite successfully up to the recent days, but clearly this is a public safety issue, and we're going to need to do things a little bit differently.
Okay, thank you, Chief. We go next to Mark Douglas from 680 News. Mark, go ahead, please.
Thank you, Chief Raymer. I think you answered some of my questions there, but a quick follow-up to the most recent question there. Just in terms of this new focus on enforcement, you say it's not bringing the hammer down, or there's been no direction to lay the hammer down. I believe Mayor Tory said so in so many words that it's time to do just that. Even if it hasn't been in specific instructions, but on the practical level, will there now be more officers in terms of a quantity of officers out doing COVID bylaw enforcement than before?
No, I think prior to this, it was across the service. We were attending when required. Going forward, the plan we have now is to use a specific group of officers to be working with our municipal partners, licensing partners, and public health, so that when we do attend these calls, we're going to get a consistent approach with a focus now on enforcement.
Thank you. Mayor Tory, then, the question for you, is Toronto going to be bringing in some of its own new bylaws to help further prevent the spread of COVID-19, or will the city be relying mostly on the new regulations that have been announced from the province over this weekend?
Well, when it comes to the size,
and as a sort of a natural part two of that, has anyone considered, or is anyone considering now, the possibility of a curfew as a bylaw?
there has been no consideration of a curfew. It's never been discussed. There has been discussion at various points in time about the hours during which alcohol is served. But having said that, what we're doing right now is spending the time looking at the legal and of course, as always, the public health benefits to be received from any additional actions we could undertake as a city, because we're limited in that regard. And as Dr. Davila indicated, we will have more to say in the coming days about additional steps we could take and that she has advised we should take in order to stop the spread of the virus. So there'll be more to come on that, but there's been no discussion of a curfew.
Okay, thank you. We go next to Talia Daragon from Radio Canada. Talia, go ahead, please.
So hi, my question is for Mayor Tory. I'm going to ask the question in English, but could you please give us an answer in French? Is that possible? So I would like to know, why do you think the closure of major roads under the Active TO program has been a success? And do you want the program to go beyond the end of September this year and even come back next year?
Nombreuses personnes ont le désir d'être actifs pendant la pandémie et tant que piétons et cyclistes en respectant les règles de santé. C'est une leçon pour nous. Mais aussi, nous avons quelques problèmes avec la circulation, mais beaucoup peuvent être résolus par les changements des signaux, par exemple. C'est une leçon aussi. Et troisième, peut-être, vous devez penser à l'avance aux événements et aux travaux de construction dans la région des rues. Maintenant, nous allons étudier les résultats de cette année et procéder au développement d'un meilleur programme pour l'année prochaine avec les changements comme nécessaire.
Thank you. And just as a follow-up, what is your response to driver complaints regarding the traffic that is creates, especially on Gardiner?
I had a chance to experience that myself. And I would just say that it's one of those things where, like everything else we do in city government, everything we do in the pandemic, there's a balance that you have to strike between making space more active and safe for people during a health pandemic and making sure that you keep the city moving. And we've tried to establish that balance. We've tried to take account of some of the issues on the Gardiner through changes to signals and through better communication and so on. And that is part of what we will examine in looking at this year's program and deciding how we can make for a better program next year in addressing issues like this, but still maintaining all the good things that came from Active TO.
Okay, thank you. We go next to Francine Copen from the Toronto Star. Francine, go ahead, please.
Yes, good afternoon. My questions are for Chief Pegg and Chief Raymer. Bylaw officers, police officers, and Toronto public health officials have been assigned more tasks. They have more things they need to enforce as a result of COVID-19. And as you pointed out, giving somebody a ticket for breaking one of the bylaws or provincial regulations around COVID-19 is complex. Have you received, have you been able to hire more bylaw officers, police officers, or Toronto public health officials in order to conduct this enforcement?
I'll start and then pass over to Chief Raymer again. I'm not aware of us increasing the number of municipal law enforcement officers to date. Having said that, one of the outcomes of the coordination meetings that we have often on a daily basis with our strategic command team and with the, I would say, the offshoots of those meetings is one of coordination. And that means there is an intentional process of prioritization that has been applied. And that process of prioritization is being applied on a very on-demand basis. So it is not a blanket policy that is applied and not reviewed for some time. These are decisions that are literally being made day to day and often live time with respect to the deployment of the resources that we have, such that they're being deployed to the areas of highest risk and the areas of highest concern from a municipal perspective. Brad, I'll pass to Chief Raymer for the police.
Thank you, Chief. Chief Raymer, go ahead, please.
There have been no increase in resources. The only difference now is, as Chief Pegg has said, is going to be a prioritization given this public safety issue. Chief Pegg and I have been working very closely on this issue and in direct contact, and that's what the issue is for us going forward, is this is now a priority, and we will prioritize resources collaboratively with the municipal licensing partners and public health.
Okay, so to recap then, you're going to be prioritizing COVID-19 calls when you can. That's what it sounds like. Is that right?
That's correct.
Thank you.
Okay, thank you, Francine. Next, we go to Dave Ryder from the Toronto Star. Dave, go ahead, please.
same theme. With enforcement, we were told, within the last couple of months that the city and the police were taking it very seriously, but we saw officers standing and bylaw enforcement officers watching a rave at Cherry Beach that was obviously breaking the rules. Earlier, we'd seen similar sort of scene at a park in Toronto. So I'm wondering now if there is a house party or a public gathering that is obviously breaking the rules, will officers break it up, or will we hear, as we heard before, that there was a danger to officers to do so, so they would just sort of monitor it?
Want to start, Chief Pegg?
Yeah, sure, I'll start. So, Dave, you've given a couple of very appropriate yet complicated examples. So, I'll try and deal with them in the order you raised them in. With respect to large gatherings such as a rave, I'm sure we can all appreciate that it often and in fact regularly is not as simple as deploying people into the center or into the midst of that party and simply breaking it up. There are very significant public safety and public order considerations that have to be maintained, and therefore each and every one of those situations warrants somewhat of an incident strategy or a strategic response, if you will. That's normal and customary work that is being performed by our enforcement officers and certainly by our police officers every day. With respect to complaints involving private residents, rights of entry are complicated and limited for municipal law enforcement officers. So hence the reason, again, why there is such a strong collaboration between our municipal law enforcement and Toronto Public Health enforcement officers and that of Toronto Police. I'll pass to Chief Raymer for further.
Chief?
Yeah, I don't know if I can add much more to that. I think that was a very thorough answer.
Okay, thank you. Follow-up, Dave?
Yeah, I do have another question. I'm still not sure I got an answer from the police chief as to whether officers would go in and break up a house party. So maybe I'll ask that if that can circle back. But my other question is for Mayor Tory, and this is from a reporter at the Star, Victoria Gibson, who writes on housing. And that was about the announcement this morning from the federal government about the acquisition fund money. Specifically, Mayor Tory, do you feel $1 billion total is enough to cover the cost of acquisitions, renovations, and modular housing when the Federation of Canadian Municipalities asked for $3.5 billion for acquisitions and renovations alone? Thank you.
Maybe I'll ask, I'm sorry, Mr. Mayor, maybe I'll ask Chief Raymer just to address that follow-up from Dave on house parties.
Yeah, we have to look at each situation individually as we go there. There's a number of avenues that we can approach depending on what we're confronted with. And there's other means to go after and identify the owner of the premises who now with the regulation may also be charged for having that event. So there's just no one answer for every situation we're confronted with, but we will be making every effort if we go to those situations and there is an infraction to investigate it, and we're appropriate, and when we can, we will be laying charges.
Thank you.
I would say with respect to the housing announcement, the following. It's a good start, but if you look at the magnitude of this problem in Toronto alone, and the $1 billion, of course, is spread right across the country, we have certainly an obligation in front of us, which I will pursue with vigor, of getting our fair share of that money, but it will be not enough to help us really get at the problem of supportive housing in the way that we have to. We have a moral case, we have a health case, and I would say just as importantly in a way in justifying further investment by both of the governments in supportive housing, we have a business case. It is going to be more cost effective for us if those governments help us by investing more money in more supportive housing than for us to stay on the present course, which is to have people put up, for example, in hotel rooms. We've proven that out. We've given the numbers to the other governments. And so I'm going to keep at this. It's a good start, and I commend the Government of Canada for coming forward with it. They've come forward with it now so we can get on with some of this, but it is not yet enough, and so we'll just have to keep up our advocacy to get more so that we can do more and do it in a cost-effective, humane way for the people who need support and who need permanent housing.
Okay, thank you. Final question is to Greg Ross from the CBC. Greg, go ahead, please.
Hello. I want to go back to enforcement and talk a little bit about, you were talking about the house parties and how difficult it can be to go in and enforce something like that. Airbnb actually came out with a release today just talking about how they're trying to crack down on some of these house parties at Airbnbs. I know you mentioned there were 21 calls today. First, I'll say part one of this is, were any of those calls about Airbnb situations? And the other part is, we have heard from some residents in condos in the downtown area that are saying that they are noticing an increase in the condos that have these Airbnbs, where you're seeing these house parties, these large gatherings at these units. Is that an issue, and how difficult is it to enforce that?
So, Greg, I'll start by saying that I don't have any information or any indication that this weekend's complaints involved Airbnbs. In fairness, that's a level of detail I'm not sure that I would be provided with, but I can tell you that I've not been made aware of any indication. I did see someone provided me some media coverage or social media coverage with respect to some changes that I understand the Airbnb and short-term rental folks are considering implementing, and I'm encouraged by that. With respect to it being difficult, I think what we heard Chief Raymer explain accurately sums that up. We receive, of course, complaints in live time. We deploy enforcement officers, including both municipal and Toronto Police, to those situations, and there is an assessment done on each and every case. That's done live time. It takes into consideration, obviously, everything from the building stock, the risk to the public in the area, the time of day, the number of people involved, and a myriad of conditions. Ultimately, all of that translating or being boiled into an incident response plan and a course of action that the responding officers will take. And I realize that we're not giving you a very definitive answer, but the honest reality is that every case is evaluated on its own merits. The way in which our enforcement folks respond is literally based on what is presented to them at the time as a net sum total of the risk, if you will, the public safety risk that exists. And I'm not sure that any two circumstances will ever be the same.
A follow-up, Greg?
And just a quick follow-up, and I want to follow up more on earlier. There was a lot of talk about how this is no longer about educating people. People should know. I mean, is the message that you're trying to send here today that it is now time, this far into this pandemic, that this has to be zero tolerance, and that the guidelines have to be adhered to, or there's going to be swift, when possible? I know that there's some issues that around investigating for bylaw officers, but does it have to be swift? Does it have to be zero tolerance right now?
It is long since time for the response on the part of the public to be swift. I agree with that entirely. We have sat and listened for a number of consecutive months now to expert public health advice being provided to us by Dr. Davila and the public health team, and we have done everything that we can do and everything that I know how to do in order to share that information, in order to educate people and help people to understand what needs to be done on a very individual and personal basis to stop the transmission of this deadly virus in our city. It is time, and has been time for many, many months, that we follow that advice to the very best of our abilities, and that we each take a very personal responsibility in doing what needs to be done to bring this pandemic under control, if for no other reason than so that we can save lives and prevent our healthcare systems from becoming overwhelmed, and so that ultimately we can go back to the lives and the lifestyles in the city that we enjoy.
May I just reread some words that I read earlier on, because I just think they bear repetition. There is a time for education, a time for warnings, and then there's a time to enforce the law and indicate clearly to those who won't comply that there are consequences. And I believe that most people acknowledge we have arrived at that time. And I really do believe that the vast majority of the people across Ontario, but certainly in the Toronto area, acknowledge that we have arrived at that time.
I believe, Mr. Mayor, you wanted to add something on another matter entirely.
Just on a slightly lighter matter, Brad, I wanted to, just on behalf of the City Council and the people of the City of Toronto, extend our congratulations on an incredible clean sweep by Schitt's Creek last night at the Emmy Awards, and to say that the Toronto sign will be lit in gold. I think it's the first celebratory lighting of the new sign that we have brought about. And just to say that I think the clean sweep where every category, whether it's the writing, the acting, the directing, right across the board, indicates the depth and the breadth of our wonderful film and television industry, which is struggling as well as many other industries in the city right now. And I think this hopefully is a great boost for them, and deservedly so. But to Eugene and Dan Levy and the whole team, congratulations from the city. We're very proud of you, and this is a great Canadian accomplishment.
Indeed. Thank you very much, Mr. Mayor. Thank you for joining us. This concludes today's media briefing.